She's having trouble getting it on to record. Ready? Okay. Welcome, everyone, and thank you for joining us today for the meeting of the New York City Health and Hospitals Audit Committee. Today's meeting is officially called to order. Please note for the record, committee member Anita Kawatra is participating virtually in a listening capacity only. I would like to propose a motion to adopt the minutes of the Audit Committee meeting held on October 16, 2023. I'm going to poll each member for his or her vote. Jose Pagan,
Yes.
Dr. Mitchell Katz.
Yes.
Rita Wong.
Yes.
Okay, the minutes are adopted. I'd like to now move into an executive session to discuss confidential and privileged matters that may be related to threatened and potential litigation. I'll poll each member for his or her vote. Jose Pagan.
Yes.
Dr. Katz.
Yes.
Rita Wong.
Yes.
Thank you, everyone. I'm going to ask that only those specifically invited proceed to the adjacent conference room.
Good, James, how are you?
We need to go.
Yes, I got it.
You don't need to.
They're only talking about the management letter.
sure everyone's here. Okay, is everyone returned that needs to be here? Great. We are now back in open session. The next item on the agenda is a presentation of the fiscal year 2023 management letter by Mr. Guzman.
Good morning. Actually, I'm going to turn it over to our colleagues at Grant Thornton to present the management letter for 2023. Tammy Radinsky to my left, and Stephen Diaguardi to the left as well.
Great. So good morning, everybody. I'm Tammy Radinsky, as David just mentioned. I'm here to present to you the formal management letter. We discussed these findings at the last audit committee meeting. So I'm just going to touch on high level the findings that we have within the written document that you should have a draft of in front of you. So there are 3 levels of deficiencies. There's a control deficiency, significant deficiency, and material weakness. Material weakness is the most severe. We're here to discuss with you what we call a significant deficiency, and as outlined in the cover letter, or the cover page to the management letter, a deficiency in internal control exists when the design or operation of a control does not allow management or its employees in the normal course of performing their assigned functions to prevent or detect or incorrect misstatements in a timely manner. As I said, material weakness is the most significant, and then in between is what we call a significant deficiency. So we have identified a significant deficiency as it relates to grants revenue and the reconciliation process regarding specific grants in the current year, and I just want to make that clear. So our management letter is focused on grant revenue and the related reconciliation in the financial statements during 2023 of the T2 grant program, which was not maintained or reconciled timely, which resulted in an immaterial overstatement of revenue in the prior fiscal year in 2022, and the recording of the adjustment-related reduction of revenue in fiscal 2023. In addition, we noted that grant revenue was recorded using budgeted rather than actual expenditures. And then lastly, the organization does not perform a reconciliation of the scheduled expenditure of federal awards to the financial statements on a timely basis. The schedule of expenditure and federal awards relates to the uniform guidance audit, which is actually performed subsequent and released subsequent to the financial statement audit in connection with the city's uniform guidance audit. So what we're recommending this year is that a formal analysis of expenditures by funding source be prepared, performed, reviewed, and approved on a monthly basis, inclusive of the appropriate documentation for all the grants received. In addition, the grant revenue should be recorded based on actual expenditures versus budgeted amounts. And we lastly recommend that the schedule of expenditures of federal awards be reconciled to the amounts reported and recorded for revenue in the financial statements prior to the issuance of the June 30th financial statements. And this will help improve oversight and ensure that the financial statements are accurate and complete as it relates to the grant revenue reporting. I'll pause there.
Tammy, oh, and then I'll open up for questions. I'm sorry, I just had a quick question.
Sure.
I think we noted, or we've talked about the difficulty of reconciling with the schedule of expenditures that the city has, the schedule of expenditures, federal awards. Is that a definite conflict in timing, or, I mean, will we always end up having this statement? Is it possible to have it be coterminous, or it's not?
So if it's addressed to me, I didn't know if you were addressing this to the grants department. Yes, this on all of our audits, the draft CFA, I'm just going to use the CFA because it's
Right.
That's the abbreviation, is reconciled and performed to your grants revenue, because your book is closed. Your books are closed for the year, so that amount should be able to be determined prior to issuing the financial statements. Because what you don't want to do is subsequent to issuing the financial statements, when you're preparing the CFA, you have a reconciling item.
Okay. I'll open it up now for questions.
Sally, just your, I mean, maybe this is more to David. The management's response says there seems to be is this what you're alluding to, Sally? There's a
Yeah.
timing mismatch maybe
Right.
in how the city does it, so.
Right, and we actually have our colleagues here if you want that can speak to the CFO finding a bit better than I can. perhaps it would be good for them to join. So I think the question relates to, I guess, the ability to reconcile in a time frame, that aligns with financial statements when there are certain items that are beyond our control that we requires inputs to the reconciliation. I think that's kind of the framework.
Right. So there are components. Hi, everyone. I'm Shalene. There are components to the CFA that relate that are external to H&H, and there are components there that come in from different organizations. So the timeline is a bit different, but there are definitely, to Tammy's point, there are subcomponents in there that are direct H&H grants that would normally make it into the financial statement. So that piece reconciles with that financial statement as we go with those components, with accruals and expenditures. The timing varies because of those external components that come into H&H to complete the CFA as a final product,
Right.
which is actually, continues until the city really
Right,
closes
so it may
that
not be
process.
possible to completely align the timing for the recommendation that Grant Thornton's making.
And that is a final product of what the actual full complete CFA is.
Right.
It'll be,
In progress.
in progress.
Okay.
Thank you.
Jose,
Quick
yeah.
question. What is the definition of formal analysis of expenditures? I was trying to understand. I'm sure there are a lot of analysis happening in the background, but
You talking about as it
Outstanding.
relates to the CFA or just in general?
for the recommendation, it says, we recommend that a formal analysis of expenditures be conducted on a monthly basis. And I was trying to understand what that,
Yeah, so all of your grant expenditures, there should be some sort of approval, of the analysis. So management should perform it together with the grants department, finance and grants, and just, sign off on that just to make sure that it's complete and accurate. Formal just means that, you have the appropriate approvals in place and management has reviewed that as appropriate.
Yeah, and the other point to note there is when we are discussing formal analyses, that's something that, from an auditor standpoint, that we can audit and test and ultimately use to essentially come to a conclusion on those certain balances. So it's really just the complete documentation, and as Tammy mentioned, something that would be reviewed, approved, and really formalized in that sense.
and then the monthly time frame is a standard time frame that is used in any organization or public sector or?
Management can determine, if you want to do it bi-monthly, that's fine. It just can't be at the end of the year. So whatever time frame makes sense. It doesn't have to necessarily be every single month. But if you keep up with something on a monthly basis, then you come to the end of the year and there's not a heavy lift.
Okay, thanks. That's it.
Okay. Dr. Katz?
No questions.
Okay. Do we have to have a motion, Colicia?
Was she done with? Are you done, Tammy?
I'm done.
Okay,
Yeah.
Unless there's other questions.
no.
No? I don't think we need a motion. We'll just accept the management letter. All right. Next, we're going to have an audit update from Mr. O'Keefe.
Thanks.
That's compliance.
Compliance.
It's out of order. Want to do compliance first?
Want to do compliance first? They have compliance slides up now instead of.
All right, let's do compliance then.
Okay.
Go ahead, Catherine.
Good morning, everyone. Catherine Patsos, Chief Corporate Compliance Officer. And this is basically an update on what has been happening in the Office of Corporate Compliance. In conjunction with the internal audits, as we had mentioned at the last meeting, we are doing a combined FY 2025 risk assessment. As part of that, risk assessment is a precursor to it. We have been doing interviews with system leadership as well as the facility leaderships. And we will be reviewing oversight agency guidance on what their work plans are to understand what their priorities and objectives are for the coming year more specifically the HHS Office of Inspector General, and hopefully the Office of Medicaid Inspector General will be having a work plan coming out shortly as well. And as far as, yes,
Question,
sure.
intervening for a moment. The audit, we're required to audit as well? And did they send out a form audit for us to use? Am I remembering
For
that
an
right?
audit of, this is for the risk assessment to determine what the risks
Oh,
are
okay.
to the organization. It's
Organization.
not an
Got
audit,
it.
no, it's internal.
Hmm.
What we do look at, though, is what areas where we have been audited by oversight agencies in the past to make sure that we are not making the same mistakes again.
Got it. Okay.
Okay, so Coalfire is our HIPAA risk analysis vendor, and they are nearly completed with the 2023 risk analysis. I will be sharing the individual results for the facilities with the CEOs. I do that at the beginning of every year, along with informing them about updates and compliance. I would note that the number of identified risks and risk levels, in other words, whether it's the risk scores, have decreased compared to last year. So we were, as previously, our risk threshold was a risk score of 15. Because we have remediated almost all of those risks, now the risk level threshold is 12. So we're looking at more moderate risks now than we had in the past. Next slide. We had a third-party risk management workshop with Coalfire in October, and that was a collaborative effort with representations from EITS, Information Security and Risk Management, Supply Chain Legal, and Procurement. And this was to streamline our vendor risk management assessment for 2024. What this is about is Coalfire analyzes the risk profile of our vendors that have access to or maintain our PHI. And we wanted to identify gaps in the security and privacy of our processes as they pertain to third-party risk management, and to compare them to the National Institutes of Standards and Technology, or NIST, supply chain risk controls, and to create an optimization roadmap for supply chain risk management. What we learned from this, some of the key takeaways, is that we do need a better system for identifying expired contracts that have BAAs, and to have better collaboration between the Office of Corporate Compliance, ISRM, and supply chain procurement to identify vendors that can be used in Coalfire's annual risk management reviews. Any questions on that?
Just a quick question. The vendor participation, are they like, is there a document that requires that they follow certain guidelines? How do we?
There are, the OCR has audit guidelines that they follow, and NIST, which is what I mentioned there, also has guidelines that should be followed, or best practices, and it's issued by the government as different areas of risk assessment that should be followed. So we had our Corporate Compliance and Ethics Week last month. It was quite successful. We had a large amount of employee participation at the tables that the corporate compliance officers had at each of their facilities. People engaged in a Jeopardy game to win prizes if they got correct answers on compliance and privacy questions. We also had an online puzzle about compliance issues. We did compliance and HIPAA webinars for people to listen to and participate in. And we'll be doing a drawing to win prizes for anyone who had completed the puzzle or attended a webinar and had done their general compliance and HIPAA training for this year. One of the efforts that we are working on with EITS is developing a policy management system, and this will allow for a more efficient procedure for drafting new operating procedures, and that portion of it is set to be completed by the end of this year. We will also be incorporating other resources such as memorandum, policies, guidance documents, tip sheets, and the like will be incorporated into this tool. It will automate the review and approval process for operating procedures and the distribution of them to their intended audiences so that they actually get pushed to the employees and workforce members who should be reading them. And as I said, we'll be expanding the tool to include guidance, administrative materials, and tip sheets. And finally, we are closing in on the year-end compliance and training statistics. These are the percents that have completed for each of the facilities as of November 15th. On November 22nd, I sent out an email to the facility CEOs attaching the employees who had not completed their training yet and asking for their support to increase the completion rates for their facilities. They have all responded that they are definitely going to make a push for that. Yes.
A year-end completion target, is that this?
Well, I would want it to be in the 90s. It's hard to get 100% because some people are, when we do it, they might be on FMLA or some other leave, and they're not able to complete it by the end of the year. And they had not done it earlier in the year, so it's hard to.
Tracking is for like annual.
This is annual, yes,
Right,
annual completion,
right.
yes.
So we should find out what Lincoln does.
Yes. That completes my report. Any other questions?
Thank you.
Okay, thank you.
Thank you very much, Catherine. And so we'll go back. Joe's your report.
Good morning, everyone. Joe O'Keefe, I'm the Chief Internal Audit Officer. The first item we have is an external audit being done by the New York City Comptroller's Office dealing with access to correctional health within the correctional system, or mental health services within the correctional system. The next item is another audit which is being done of the Behavioral Health Emergency Assistance Response Division. It's being audited to look at the services that we provide under mental health with the city. Both audits are ongoing at this point. Both are primarily stuck on the same point, which is access to mental health records. And the city is looking to come back to us with an acceptable method of audit for which they can complete both of these audits. The next sheet we have, it just gives, okay, can we go to the next slide? Oh, I thought, okay, they're both the same thing. Okay, sorry. This is the same audit. This is the Be Heard program. It's the audit we just discussed. Both audits are stuck on this, actually, as I said, the same issue. This just gives stats for the audit. We have 14 audits on the plan. This is just the status of the plans at this point. Next is system-wide review of nursing. The report on this has been drafted. The audit is complete. It's drafted. We're just now working out basically management's responses to issues that came up during the audit, and then the audit will be finalized. The next audit we have is patient valuables. It was completed at Jacoby Medical Center. Audit's complete. Fairly standard issues that we had noted at other facilities where this audit was being done. And there are audits. The next item is auxiliary audits.
Sorry, did you talk about the system-wide review of nurse hiring?
Excuse me?
Oh, we did go by that?
We can go back.
Sorry.
You can go back if you have.
Did you say it's completed, but you didn't mention any findings?
We didn't get.
No, right now we're working out with what management responses to the
Oh,
findings
so
and
it's
things
not
are based. So
completed,
once it's
you're just-
finalized,
yeah.
you will get a copy of
I
the
see.
report.
Okay, thank you. Sorry, I missed that.
Yeah, sorry. I missed that. The next is auxiliary audits. We're working on, with the Bonadeo Group, is working on the calendar year 21 and 22 audits. 2022 will be the last year for which we pay for these audits. They're in various states of progress at this point for the various auxiliaries. And that is my report for the thing. Anybody have any questions? Thank you.
We've had a nursing audit before.
Excuse
and
me?
We've done a nursing audit before. Were you able to like piggyback onto that, or this is like really
This is
all
really
new?
separate from it. We're looking at basically the onboarding of the nurses and are all the background checks, criminal, financial things, everything that's being done that's required to bring them on board is being done. Or do they have the proper education, licensure, things like that were being done. So we weren't really piggybacking on the older audit.
Okay. Are there any other questions, comments? Okay. Is there any old business to be discussed? Any new business? Okay, if there's no further discussion, the meeting's adjourned. Thank you.
Thank you. This meeting is no longer being recorded.